All right, welcome. Your surgery is done, which is great news. Now, the big focus shifts to your recovery. Think of this as your personal guide to a smooth and successful healing journey. We're going to walk through everything you need to know and do in the coming days and weeks.
Okay, so the procedure itself is in the rearview mirror. And, it's totally normal to be wondering, what happens now? Don't worry, we've got you covered. We're going to go through all the post-op instructions step by step, so you'll feel confident about what to do and what to expect while you heal.
All right, first section, what to expect initially. We're going to talk about what's totally normal in those first few days. So let's dive right in with the stuff you're likely to see and feel. First off, don't be alarmed by some mild bruising and swelling around the scrotum. That's completely expected. A little bit of bleeding from the incisions, also normal. You'll probably see some scabbing on the glans of the penis too. And yeah, you might feel some mild pain in the perineum, scrotum, and even your hips, but that pain should actually start to get better once you start moving around a bit.
Okay, a few other things might catch you off guard but are actually a normal part of this whole process. Nocturnal erections, they're going to happen, and yes, they might be a bit painful for a few weeks. You might also see some urine or even a bloody-looking fluid leaking around the catheter. That, plus some bladder spasms, which can feel like pressure or a bit of pain, are all things we expect to see. So, deep breath, it's all part of the plan.
Okay, moving on to our next section, your recovery blueprint. This is all about activity, diet, and lifestyle. Basically, the rules for living for the next few weeks.
Here's your activity roadmap, and it is really important to stick to these timelines. For the first 3 weeks, no driving or long car trips. Simple as that. For a full 6 weeks, absolutely no heavy lifting or any kind of intense, vigorous activity. And this one is crucial. You've got to wait at least 8 weeks before any sexual activity. Your body just needs that time to heal up properly.
And when we say no heavy lifting, we mean it. For those first 6 weeks, the magic number is 5 pounds. That's your absolute max. To put that into perspective, that's about a half gallon of milk. Seriously, nothing heavier than that. It's so important for preventing any setbacks.
So, we're avoiding the heavy stuff, but that does not mean you should become a couch potato. The do here is to get up and walk around several times a day. It's fantastic for your circulation and healing. The don't, just sitting around. And another big don't, bending at your back. If you need to pick something up, always bend at your knees. It takes all the pressure off that healing area.
All right, let's talk food and drink. Good news is you can pretty much get back to your regular diet as soon as you feel up for it. The number one rule though, water. Aim for 6 to 8 glasses every day. It's a game changer for healing and, super importantly, it helps keep you from getting constipated. Speaking of which, upping your fiber with fruits and veggies is a great idea. And hey, a little prune or apple juice can't hurt either.
And to piggyback on that last point about constipation, this is so important. You absolutely have to avoid straining when you go to the bathroom. That pressure is exactly what we don't want on your surgical site. So we really recommend using a stool softener, something like Colace. And if that's not quite enough, a gentle laxative like milk of magnesia or Miralax is also an option.
Okay, next up, caring for yourself at home. This is where we get into the nitty-gritty of incision, graft, and catheter care.
Keeping things clean is your number one defense against infection. So once those first dressings are off, the routine is to shower twice a day. It's a simple process. Just gently wash the incisions with soap and water. Rinse it all off really well, and then pat, don't rub, pat the area dry. And the big rule here, no soaking. That means no baths, no hot tubs, and no swimming for 6 whole weeks.
Now, if you had a skin graft, this part is for you. Once that protective bolster dressing comes off, you'll keep up with the twice daily showers. The key here is to be super gentle. Just let the soapy water wash over the graft. Please do not scrub it. After your shower, gently pat it dry and then let it air dry the rest of the way. The final step is to apply Aquaphor to the glands and the graft a few times a day, say 2 to 4 times, to keep everything nice and moisturized.
Okay, what about the donor site, the spot where the graft was taken from, usually your leg? Simple. Just leave that first dressing on for about 5 to 7 days. Once it's off, you just want to let it air out. Honestly, wearing shorts around the house is perfect for this. Helps it scab over. Now here's a little pro tip for you. To keep it from sticking to your clothes or sheets, you can put on a layer of Aquaphor and then cover it with the piece of plastic wrap before you put on pants or go to bed.
All right, let's talk catheter care, which is absolutely critical. First thing, that catheter needs to be anchored. Taped down to your thigh, calf, or belly at all times. We really don't want it getting pulled by accident.
Then, 3 times a day, you're going to gently wash right around where the catheter goes in, just using simple soap and water. And right after you wash it, just dab a little bit of triple antibiotic ointment around that entry point. It's a quick, easy routine that makes a huge difference.
Okay, last section, and this one is super important. When to call your doctor. Let's cover the warning signs you need to know about.
So, the big question: when exactly should you be contacting your doctor's office? Let's go through the list so you're totally clear. First up, a fever. If your temperature gets over 101 degrees Fahrenheit, that's a signal to call the office. It could be a sign of an infection, so we want to know about it right away.
And here are some other red flags that mean you should call us right away. If your incision is getting more red or swollen, if it starts to open up, or if you see any pus-like drainage, that's a call. If your catheter comes out or gets blocked, and you notice you haven't had any urine for a couple of hours, that's another call. Also, if you're in severe pain that your meds just aren't touching, or if you start getting chills, nausea, or vomiting, you guessed it, give us a call.
So for any of those things we just mentioned, or really for any questions or concerns that pop up, here's the number to call. Go ahead and plug this into your phone right now, or write it down and stick it on the fridge. Just make sure you have it handy.
And last but not least, let's be crystal clear. If something feels like a real emergency, don't call the office. Call 911 or get to the nearest ER right away. Look, your health is number one, and following all these steps is going to set you up for the best possible recovery. You got this.